Is hydromorphone a safe drug? Should you be taking it? Today we're going to talk about hydromorphone. What is it? Why do we use it? What are the side effects? What makes it dangerous? Who should take it? And maybe most importantly, how to be safe if you need to take it. And be sure to stay till the end when I will share with you my personal experience with this drug.
Welcome to Pharmacist Michael's Happy Healthy Living channel, where you will learn how to improve your life, one video at a time.
Hydromorphone is used for the relief of moderate to severe pain. And we use this medication when other pain relievers, such as morphine, tramadol, codeine, hydrocodone, oxycodone, drugs like that aren't effective. This drug can be administered in various forms, including oral tablets, injectables, and even rectal suppositories. We often use it in clinical settings for acute pain management, such as post-op pain, or during invasive medical procedures. It's also used in the management of chronic pain when other less potent opiates aren't effective. Hydromorphone is an opiate, and that means that it works by binding to opioid receptors in the brain, spinal cord, and other parts of the body. This binding alters the perception of pain and the emotional response to pain. The drug works centrally in the brain to decrease the feelings of pain and discomfort, but does not treat the underlying causes of the pain. We normally start with a low dose of hydromorphone and adjust it based on individual response. For chronic pain, we may also use a controlled release tablet, which provides longer-acting pain relief. Now let's talk a little bit about side effects. The common side effects of hydromorphone are things like nausea, vomiting, constipation, dizziness, drowsiness, and sweating. These side effects often can be managed with supportive care and dose adjustment. There are times when more severe side effects such as respiratory depression, hypotension, and profound sedation may occur, especially with higher doses or in sensitive patients. Hydromorphone is contraindicated in patients with significant respiratory depression, acute or severe bronchial asthma, and those with a known hypersensitivity to the drug. It should be used with extreme caution in patients with head injury, intracranial lesions, or increased intracranial pressure, because opiates can obscure the clinical course and management of patients with head injuries. Hydromorphone does have some drugs that it interacts with, potentially increasing the risk of side effects or even diminishing its efficacy. These interactions can occur with other CNS depressants, anticholinergic drugs, MAO inhibitors, and mixed agonist-antagonist opiates. Careful management and consultation with healthcare providers are essential when hydromorphone is prescribed alongside other medications. If you must take it, be safe. Stick to the dose and frequency that your doctor prescribes. Don't mix it with other CNS depressants. This includes alcohol, and be sure to have naloxone available and tell your family or friends in case it needs to be used. Because remember, if you overdose or accidentally take too much and end up unconscious, you're not going to be able to administer the naloxone yourself. Now, naloxone can come in different forms. It can come in injectable form, but it also comes in a really easy to use nasal spray. But I think it's very important, especially if you're going to be on this drug for an extended period of time, to have naloxone available. One of the most critical considerations of hydromorphone is its high potential for addiction. Opiates can be highly addictive due to their euphoric effects and the body's physical dependence on them after prolonged use. Addiction can develop even at prescribed doses, and is more likely in individuals with a personal or family history of substance abuse. Regular monitoring and assessment are also critical when a patient is on hydromorphone therapy. This includes assessing pain relief efficacy, monitoring for adverse effects, and signs of addiction or dependency. Adjustments to the therapy, including tapering or switching medications, may be necessary based on the patient's response. Now, as I promised, I'm going to talk to you about my story. In 2004, I was hospitalized for GI bleeding, and I received hydromorphone while in the hospital. I remember it only as being very highly euphoric, and I remember a yellowish tint to everything I looked at. I can also remember having absolutely no pain. And they did try other medications. They tried morphine, which I had itching to. The fentanyl they gave me did nothing, but the hydromorphone really did work amazingly well. I have to say that I wasn't myself when I was on it, and also that I did things that I don't remember. Because I had a hospital roommate at the time, and some things happened at night, interactions between the nurses and myself, that I didn't even remember. So this drug really does work well for pain, but in my case at least, it was really a personality-changing drug, and I don't even remember a lot of the things that happened while I was on it. Now, as always, if you have any questions about hydromorphone or any other drug for that matter, or even nutritional supplements, make sure to leave them in the comments section of this video. If you've enjoyed this video, give it a thumbs up, and don't forget to subscribe to our channel for more happy, healthy living information. Thank you so much for watching. And until next time, my name is Pharmacist Michael. Be happy and be healthy.